Here's a checklist to unlock success. Focus on achieving the goals you've set. Think and act on them daily. Stick to a schedule and always learn new ways to improve the way you do things, process and commit to growth instead of worrying. Do these things for a richer and more fulfilling life experience. Hello and welcome. I'm Arroyo Eubanks. Thanks for making it Jamaica Magazine. On today's pages, we'll look at what's in the national budget to do the work of the Ministry of Science, Technology, Energy and Mining in the new fiscal year, plus how you can prevent avoidable heart diseases. Later, a peek at government's immunization campaign, advancing the goal of a healthy population. We'll also have our top news stories of the week, so sit back and relax as Jamaica Magazine unfolds.
We want a productive Jamaica. We are not productive Jamaicans. Productivity to move forward on this land. Productivity, that's the way to go, we should understand. Productivity is the way to go for all us Jamaicans. Small business, big business, old and young, we are tell every woman and man. We want growth and prosperity for a better nation with a building plan. So we can build our product and sell our product and put more money in our hand. Our economy can rise to a level and build a better nation. Productivity to move forward on this land. Productivity, that's the way to go, we should understand. Productivity to move forward on this land. Productivity, that's the way to go, we should understand.
Productivity, pathway to prosperity. A message brought to you by the Jamaica Productivity Center, a department of the Ministry of Labor and Social Security.
A little over $8.9 billion. Total expenditure budget for the Ministry of Science, Technology, Energy and Mining in the 2015-2016 financial year. The money will continue key projects and implement new ones within the sector and offset operational costs and compensation packages for workers. During the fiscal year 2015-2016, the Ministry of Science, Technology, Energy and Mining will use a combined $4.1 million to promote and encourage investment in metallic and non-metallic minerals. A further $20 million will be used to foster and advance the national policy and strategy for science and technology. More capacity strengthening follows with the increased spending power of the Scientific Research Council, SRC. Among other things, the SRC will contribute to the technological development of priority sectors and provide quality scientific technology solutions. Over $27 million will go towards the Earthquake Unit to do further seismic research. This year, the unit will publish a document on Jamaica's seismic code and maps, contribute data to the Caribbean Tsunami Warning Program, implement an effective earthquake early warning program, and release information to guide the National Building Code. In the area of energy, the Rural Electrification Program, now renamed National Energy Solutions, will construct 30 kilometers of pole line extensions in 10 parishes and wire 1,000 houses to facilitate formal connection to the national grid, reducing the remaining 3% of unconnected areas. Other works will get done through funding from bilateral and multilateral partners. These are in the areas of energy security, efficiency and conservation. To advance the Information, Communications and Technology sector ICT, the eGov Jamaica unit has been allocated $1.4 billion to support initiatives such as the National Identification Systems, Human Capital Management System, Enterprise Content Management, and the Government Network, GovNet. With its budget of $250 million, the e-learning project will continue building out the technology infrastructure and lend support services to the Ministry of Education. $700 million will be used to extend the Tablets in Schools project. 17,920 computer tablets will be distributed in 25 additional institutions island-wide. Work under the Enhancing the ICT Regulatory Environment project will enable the government to facilitate future broadband development while tailoring market interventions to complement private sector investments. Meanwhile, $70 million is allocated to provide more opportunities for young persons who are skilled in animation. Under the Youth Employment in Digital and Creative Industries project, 190 computers, 385 tablets, 335 2D software licenses, and 40 software upgrades for an animation laboratory will be purchased. It will also allow the procurement of consultancy services for animation training programs and facilitate the development of Digital Jam and Kingstoon. So as the Ministry of Science, Technology, Energy and Mining puts strategic plans in place to strengthen its capacity, improve human capital development and social infrastructure, and facilitate investments, government is also putting the funds in place to carry them out.
Know your numbers and control the keys to a healthier heart. Know the numbers for your blood pressure, cholesterol level, blood glucose level, and your weight and body mass index. Find out the risks they represent and what you need to do to stay healthy. Talk to your doctor and start making healthy lifestyle choices to prevent a heart attack or stroke.
Tackling non-communicable diseases like hypertension and heart disease is important. Why? Because these illnesses cost Jamaicans millions of dollars every year. Believe me, treatment is expensive, so avoid heart disease. Here's how.
We often associate the heart with emotions of joy and feelings of affection. Its image, even its pounding beat, has a firm link to expressions of love. But despite this much fondness, we have a tendency, without much thought, to put our hearts at risk of damage and, as a result, our lives in danger. How? Simply through improper diet and inadequate physical activity.
The evidence is well established and well known that a balanced diet is among the behaviors crucial to a healthy heart and circulation system.
And based on a 2008 health and lifestyle survey, most Jamaicans are not eating enough fruits, vegetables, and peas and beans and are not as physically active as they should be.
The society has seemingly been taken with the bag juice, a love of processed and fast food with high salt, sugar, and fat content in these modern days. This is wreaking havoc on individuals' health and the resources of the health sector.
Having identified those factors believed to be contributing to the current trend in heart disease, the #1 cause of death in Jamaica and the Caribbean, we must take the steps to avoid the dangers. Steps that include proper portion sizes and making healthy food choices. The Ministry of Health, in partnership with non-government organizations such as the Heart Foundation of Jamaica, is encouraging healthy eating habits to reduce the incidences of heart disease.
We continue to recommend healthy food choices in schools and other public institutions and promote the consumption of a variety of fruits and vegetables daily and the reduction of salt and fats in your diet. 30 minutes of physical activity per day at least 3 times per week, and to make physical activity a part of your daily routine.
The ministry has also developed a manual on physical activity for the workplace to ensure that even while we work, we can enjoy the benefits of exercise. Eating just the required amount of nutrients has been proven to provide a healthy heart and circulatory system, while overindulging gives rise to cardiovascular diseases such as hypertension. And it's been found that heart disease is more common among people with hypertension or high blood pressure.
What hypertension does to the vessels we call arteries, which carry blood to the tissues. It causes a thickening of the wall of the arteries, the pulse we feel. The heart is getting bigger. It should require more blood, and it does. But at the same time, that pressure is also limiting the blood flow by causing hardening and narrowing of the vessels. So it's small wonder then there comes a time when the heart is going to be, its function is going to be seriously jeopardized.
Chronic kidney disease, another potential complication of hypertension, is also a contributor to the development of heart diseases. Since these diseases, which are common in adults, have been found to have their genesis in childhood years, eating healthy must start with our children.
If we can have an influence on our children with the intake and guide them on how they eat, we will start preventing generation after generation. A healthy child is one who eats fruits and vegetables.
To maintain good health, nutritionists recommend including items from all the food groups in our diets in the appropriate portions.
Challenge yourself. Don't eat processed food. Let's eat more natural, wholesome food, where sodium is extremely low and natural. Let us try and eat one packaged food a day, but let us incorporate an average of 5 servings of fruit and vegetables. A serving is just an orange, just a banana, maybe 2 cups of lettuce, or 1 cup of pumpkin, or a cup of callaloo. That's all that a serving is.
Nutritionists also recommend that we avoid fried foods and instead broil, oven roast, and steam. It is important also to limit sugary beverages and foods with added sugars. The daily recommended intake for sugar is 6 teaspoons for women and 9 teaspoons for men. As it relates to sodium or table salt, our body needs less than 1 gram per day, and that's less than half a teaspoon. Measuring the quantity of sugar, salt, and fats requires us to be vigilant, reading labels and taking note of their quantity in each serving. In seeking to help Jamaicans make the shift from current unhealthy eating habits, the Ministry of Health has moved to provide food-based dietary guidelines. The availability of these guidelines and practical use by each of us is expected to result in a healthier nation with less non-communicable diseases. We'd be avoiding early deaths from heart conditions. So let's live more and love more. Let's make our food or medicine for good hearts and good health.
If you not get it, you will lose. Make your food be your medicine, your food. Blend up your carrot with the lettuce in a juice.
Parents, make sure the children get immunized. Hear this! Immunization, it is a must. This is not a joke thing, this you can trust. It is required by law for entry to nursery, to daycare and to schools. Listen up, it is necessary to prevent diseases such as the measles, the poliomyelitis, the lockjaw and the whooping cough. Immunize your kids, keep them healthy, keep them strong. Prevent deadly diseases such as mumps, rubella and diphtheria. Immunize your child today. Immunization, a key to good health.
A message from the Ministry of Health and PAHO.
Having a healthy and productive population is one of the key goals of Jamaica's National Development Plan. While government does its part to achieve this goal, all of us must take responsibility for our health, ensuring that every child is properly immunized against deadly diseases. More in this feature.
Picture the world without vaccines. There would be widespread epidemics, unstoppable diseases, and death. Thanks to vaccines, we are able to protect ourselves. Vaccines are medicines, but unlike those that cure or treat diseases, they prevent them. Jamaica has long been engaged in this preventive mode of healthcare, even enacting laws to enforce compliance.
Jamaica has had a very robust, expanded program on immunization, which has allowed us to have very high coverages for our vaccines.
Since the country's first expanded program of immunization in 1977, Jamaica has eradicated and eliminated many serious diseases. The country had its last case of polio in 1982, the last case of locally transmitted measles in 1991, diphtheria in 1995, and rubella or German measles in 2000. The last case of newborn tetanus was in 2001. Still, this is no reason to let down our guard, as many countries still have annual cases and outbreaks of vaccine-preventable diseases such as measles, which can spread through international travel and tourism.
Jamaica is a well-established tourist destination, and so we have to remain vigilant in terms of the introduction of diseases into the country, and therefore do all that we can to reduce any possible impact on our population.
In early 2015, a measles outbreak in nearby United States highlighted this need to remain vigilant. In response, the Health Ministry launched a multi-million-dollar measles prevention campaign in February. It targets 195,000 children island-wide, ages 1 through to 6, in 3 phases.
Phase 1 will target children attending clinics at the health centers for routine immunization services such as the 18 months booster doses. Phase 2 will seek to capture children at the basic infant primary schools and daycare centers. And Phase 3 will focus on targeted community outreach for those who were not immunized in Phase 1 and 2.
The campaign, which runs from February 16 to May 8, primarily involves procuring and administering additional doses of the measles, mumps, and rubella MMR vaccine.
We will be going into communities to ensure that the children that we have not as yet seen in the health centers or in the schools, that they are immunized.
Children who may have missed their complete MMR doses or any other compulsory vaccines available in the public health sector will be given them during the campaign. Measles is a highly contagious respiratory infection caused by a virus. Symptoms generally appear 10 to 14 days after exposure to the virus and include a fever, dry cough, runny nose, sore throat, inflamed eyes, and skin rash.
It is spread by coughing, sneezing, direct contact with persons who are ill with the measles virus, and also contact with any of the droplets, the materials. This virus can remain alive on surfaces for up to 2 hours. It presents as a non-specific flu-like illness.
Everyone has a role to play in keeping Jamaica measles free. Parents and guardians are to ensure every child is fully immunized.
The Ministry of Health provides vaccines for children at no cost in the public health sector. This was the case prior to the introduction of the no user fees policy. And continue.
So get your child's immunization card or child health passport ready and visit your nearest public health center or clinic. The current 3-phase immunization campaign is running concurrently in all parishes.
All our health facilities type 3s and above are now designated daily vaccination sites from Monday to Friday during normal opening hours. So parents would need to bring, for children born before 2010, their immunization cards. But we implemented in 2010 the Child Health Development Passport, which have the immunization record. And once they take those, the public health team, which is usually either the public health nurse or the midwife within the clinic, would check, see what vaccines the child would be eligible for, and administer same.
Everyone in the targeted population will be vaccinated unless they can provide documented proof that they have received the completed doses of the MMR vaccine and any other compulsory vaccine. The Ministry of Health has taken the decision to offer the completed dosage of MMR vaccinations earlier. Children born July 2013 and after are now offered the booster dose of the MMR vaccine at 18 months old instead of 4 to 6 years.
It therefore requires that those children who would be 2 and 3 years old, and in the previous schedule they would be getting their vaccine at 4 to 6 years old. All of those children would be among the group that we need to immunize now.
Under the country's 1986 Public Health Act, all children should be fully vaccinated by their first birthday and get booster shots after that. And all children under the age of 7 must be adequately vaccinated for their age prior to entry to school, which includes nursery and daycare facilities.
It is the duty of every parent to have their child immunized.
Failure to comply with the regulations can result in prosecution in a court of law. The regulations only allow for exemption from vaccination based on medical reasons and not on religious or philosophical beliefs. Prevention is better than cure. Vaccinate today and reduce the risk of infection from potentially dangerous vaccine-preventable diseases.
Are you registered to vote? If not, don't miss your chance of getting on the next voters list. The deadline for registration is Tuesday, March 31. Persons not registered by March 31 will not be on the May voters list and cannot be added before November 2015. To get registered, simply visit the EOJ constituency office nearest you. For more information, call us at 922-0425 or visit ecj.com.jm. Remember, voting is your right.
Employers, tired of waiting in long lines at the tax office? Wait no further. Government is making it easier for you to pay taxes. As of January 1, 2015, file your employer's annual returns online. No lines, no hassle. Tax Administration Jamaica TAJ will be implementing the mandatory electronic filing of all employers' annual returns. So get with the program and save time and energy. For more information, call 1-888-TAX-HELP. That's 1-888-829-4357 or visit jamaicatax.gov.jm.
Coming up next are top news stories of the week.
Hi there, I'm Carrie-Ann Smith with your JIS News of the Week. Prime Minister Portia Simpson-Miller made her contribution to the budget debate on Tuesday and announced the resumption of bauxite extraction at Alpart in Nain, St. Elizabeth.
The company has already employed 40 people and has committed to hire an additional 70 persons by the end of this month and is on track to hire 250 people in total for the duration of the project.
The plant will begin hauling bauxite to the port next month. Mrs. Simpson-Miller also revealed that expansion of the Kingston Container Terminal was gaining traction as Cabinet had approved the signing of a concession agreement with a preferred bidder on Monday. The contract will be signed on April 7, allowing Terminal Link CMA CGM Consortium to finance, expand and operate the Kingston Container Terminal. The Prime Minister also used her budget presentation to declare that the law was being amended to allow for stiffer penalties when a girl is murdered and the perpetrator knew that she was pregnant.
This is to be treated as an aggravating feature in determining the sentence imposed by the court, so that the murderer receives significantly harsher punishment in the form of a longer sentence.
Mrs. Simpson-Miller said the nation could not allow the murder, rape, incest, and other forms of abuse perpetrated against children to continue. Finance Minister Dr. Peter Phillips closed the budget debate on Wednesday and revealed that government would be setting up an energy stabilization fund to receive and manage the money from the oil hedge program. It will protect against any sharp increases to international oil prices and the potential negative consequences for Jamaica's economy.
These resources include the proceeds from a portion of the additional $7 per litre of specific STC, specifically $5 per litre, as well as any future payments from the hedge contract should future oil price movements lead to such payments.
He said the money for the Energy Stabilization Fund would go into a dedicated sub-account in the Bank of Jamaica and would be managed by the Development Bank of Jamaica in conjunction with the Finance Ministry. Public sector wage negotiations for the 2015-2017 contract period formally began at the Ministry of Finance and Planning on Thursday. The negotiations were led by Minister with responsibility for the public service, Horace Daly, and the Chief Technical Negotiating Team representing the Jamaica Confederation of Trade Unions, JCTU. The negotiating team is led by JCTU Vice President Helene Davis White. Approximately 37 bargaining units will be negotiating with the government during this period. The authorities this week successfully extinguished the fire that had been burning at the Riverton disposal site since March 11. For the rest of the week, firefighters continue to seek out hot spots to carry out further cooling operations. Meanwhile, Minister Noel R. Scott announced that the local government ministry was looking at a number of programs for improving operations at the disposal site.
Currently, we have an expression of interest, EOI, out for those who are interested to deal with waste management. We have in the budget 75 million. Now I'm going to make a special appeal, probably to draw down some funds from the environmental levy to help us on a continuous basis to be able to contain the landfill until we get to the longer term of divesting the facility to the private sector.
The minister also revealed that he had appointed a team to review the operations of the National Solid Waste Management Authority. The 2015 Grade 6 Achievement Test GSAT went off smoothly on Thursday and Friday of this week. On day one, the Education Minister said there was residual smoke at schools in the vicinity of the Riverton City Disposal Site in St. Andrew, but reported that students and teachers said it was manageable and would not affect the holding of the exam. The starting time was changed this year to 9:30 a.m. to limit students' exposure to smog from the disposal site. In St. James and Westmoreland, meanwhile, several students who had not previously registered for GSAT turned up and were allowed to sit the exam. And finally, Prime Minister Portia Simpson Miller was in New York this week to attend the UN General Assembly plenary meeting to commemorate the March 25 International Day of Remembrance of the victims of slavery and the transatlantic slave trade. Prior to the meeting, Mrs. Simpson Miller unveiled the permanent memorial to honor the victims of slavery and the transatlantic slave trade at the UN headquarters. She urged peoples of the world to band together to end all forms of modern-day slavery.
And I want to mention particularly child labor and human trafficking. This must stop. May we use this memorial to say no to all forms of racism, discrimination, and intolerance, and maintain the fight to end racial discrimination and injustice wherever in the world they exist.
Mrs. Simpson Miller also engaged members of the Jamaican diaspora at a town hall meeting. And those were some of the stories making news this week. I'm Carrie Ann Smith.
Each time you're not paying full attention to the road environment, the greater your chances of getting in a crash like that. Plan routes to avoid focusing on GPS systems, prevent children from roaming in motor vehicles, turn down the volume of car stereo systems, pull off the roadway if you have to use mobile devices, do not read, watch television or eat while driving, avoid multitasking, and keep conversations with other passengers to a minimum. Whether you walk, ride, or drive, avoid potentially fatal distractions.
This is where we close Jamaica Magazine for today. Be sure to join us again tomorrow with more information. We want you to keep the link, use our Facebook and Twitter pages, YouTube channel, and the JIS website to stay in touch for the very latest government information. You may also send an email to jamaicamagazine@jis.gov.jm with your comments or questions. I'm Oroya Eubanks. Until we meet again, take care.
This has been a production of the Jamaica Information Service, the voice of Jamaica.